More pandemic restrictions have been announced today in Germany, including a lockdown for residents who are not vaccinated. The stricter measures come as the country continues to grapple with its fourth wave. CBC's Tessa Arcilia is tracking this story live from London. What are the details, Tessa?
Yeah, that is the latest development, Suhana, from Germany. The government announcing that they will be curbing the movements, essentially, of the unvaccinated part of the population, barring them from essentially most of public life, apart from the essential. So they cannot go to non-essential shops, gyms, cinemas, cultural activities, and even Christmas markets. So basically, it's one step closer to compulsory vaccinations, essentially saying, sure, you have a choice of not getting the vaccine, but you're not going to be able to do much. And the government is going to consider as well mandatory vaccinations that's being debated in the German parliament. They're looking at making it compulsory by February or March next year, which is something that the Austrians have also already been considering. Now, the idea of compulsory vaccinations obviously will stir a lot of debate, but the European Commission chief Ursula von der Leyen had floated the idea of a Europe-wide response in this sense. Take a listen.
I think it is understandable and appropriate to lead this discussion now, how we can encourage and potentially think about mandatory vaccination within the European Union. This needs discussion. This needs a common approach, but it is a discussion that I think has to be led.
She says discussion there, Suhana, but I think there will be some pushback, especially from countries in Europe with very low vaccination rates. She pointed out that the worry is that up to a third of European citizens are still not vaccinated. That's about 150 million people, Suhana. So that is the worry.
And in South Africa, Tessa, where Omicron was first reported, infections have exploded. What is the latest from there?
That's the right word, exploded. I think scientists really are sounding an alarm over the fact that there are exponential increases, which isn't entirely surprising. But I think now that they're putting numbers into the kind of how fast the number of cases are going up, that is worrying them. So in the beginning, when they started testing samples from the beginning of November, there were around 300 cases a day that were identified. That went up to 1,000 last week and then 3,500 recently. And just yesterday, Suhana, 8,500 cases were identified. So you can see just how quick that progression is. Now, here in the UK, of course, the push, just like in Canada, is for boosters. They have ordered more than 100 million more boosters to future-proof, as they say, the population. Take a listen to what the health secretary had to say.
Will be the latest vaccines that they will have, because as we're seeing right now, there's a new variant, there's potentially new variants in the future. We know that COVID's going to be around for a while. We have to learn to live with it, and one of the ways to learn to live with it is to make sure we've got the vaccines that we need and that they're future-proof.
And just very quickly, something that we're also keeping an eye on, Suhana, is a new drug by GlaxoSmithKline that was approved by the UK for treating COVID. It seems like it is also effective against the Omicron variant, but that's something we need to keep an eye on. Suhana?
We will talk again. CBC's Tessa Arcilia in London.